Serious recessive and X-linked conditions affect about 1 in 300 pregnancies. Expanded carrier screening tests reproductive partners' carrier status for a large number of these conditions. When expanded carrier screening is done before a couple becomes pregnant, results enable interventions to reduce the chance of having an affected pregnancy. We examined the clinical utility of preconception expanded carrier screening by studying the actions of 235 couples identified as being at high risk of having future pregnancies affected with a serious genetic condition. 77% of couples reported that they planned or were actively pursuing actions to reduce the risk of having an affected pregnancy. These included in vitro fertilization with pre-implantation genetic testing, use of a sperm or egg donor, adoption, avoiding pregnancy, and planning for prenatal diagnostic testing once they became pregnant. In pregnancies that occurred in these couples after they received their expanded carrier screening results, couples chose to undergo prenatal diagnosis about a third of the time. This number is similar to the proportion of couples who choose to undergo prenatal diagnosis after a positive trisomy 21 screen. Among couples who decided not to undergo prenatal diagnosis, almost half were planning or had already undertaken diagnostic testing after the baby was born, avoiding a long diagnostic odyssey for an affected baby. Preconception expanded carrier screening guides changes in pregnancy management that result in fewer births affected with serious genetic conditions. Our study demonstrates the clinical utility of screening for serious conditions that have historically gone undetected.